Good evening, everyone. The rift is growing tonight between a president who holds that there are no limits to his power and governors on the East and West coasts who have formed alliances to set their own criteria for rebooting the economy. But that kind of talk was briefly drowned out here in New York late today when officials acknowledged what was widely feared, that the number of dead is far higher than reported. Tonight, more than 3,700 additional names being added to the state's already staggering death toll that now tops 10,000. Our team is in place. Let's begin with the latest on the pandemic and Gabe Gutierrez in New York.
At the nation's epicenter, a stunning spike. Late today, New York City abruptly increased its death toll by 3,700. City officials say the total is now more than 10,000 because they're now including people who'd never tested positive for COVID-19, but were presumed to have died from it. The virus is increasingly targeting the most vulnerable.
The percentage of loss of life is getting higher in the nursing homes.
Around the country, deaths at long-term care facilities are mounting. NBC News counts 4,300 across 27 states, almost double last week's number. There are heartbreaking reports in Massachusetts, Virginia, and New Jersey, leaving loved ones in limbo.
There's got to be more personal contact. These people are dying, and they're getting a letter. It's really sad.
And new hotspots are emerging from Indiana.
These people might walk in through the emergency department, and within an hour, they're on life support.
To Missouri.
I've been a nurse for 11 years, and I have to say this is something that I've never seen before.
To South Dakota, where the governor is resisting a stay-at-home order, despite one of the nation's largest pork processing plants shutting down after more than 400 workers got sick.
This plant would have been up and running because it is exempted as an essential business that is a part of our critical infrastructure plan.
In New York, the curve is flattening, but despite assurances that there's enough protective gear for medical workers, New York City officials are now asking sports teams for rain ponchos to use as makeshift surgical gowns for a health system still under incredible stress.
In the past 2 weeks, I've probably seen as much death as I've seen in the past 3 years. It's bad. It's really sad.
Dr. Angelo Sia is a third-year ER resident at St. Barnabas Hospital in the Bronx, where these refrigerated trailers act as temporary morgues.
I feel like at this point, everybody we intubate is just, it's terminal. Like, it almost feels futile.
Among the lives lost, Bernie Rubin, the co-founder of an iconic New England furniture store chain. Abdul Ahad Wahab and his wife Tazroon both died from the virus outside Houston. They'd been married 53 years.
It was just so fast. I dropped my parents off at the ER, my dad on Friday and my mom on Saturday. And they were not even a week in the hospital. They passed away.
The CDC says more than 9,000 healthcare workers have reported testing positive for COVID-19, likely an underestimation. Lester?
All right, Gabe Gutierrez, thank you. Now to the enormous challenge of reopening the country. Tonight, California's governor is laying out
Testing capacity.
According to the COVID tracking project, roughly 150,000 people are tested every day.
Widespread diagnostics are the key. So let's keep pushing that forward to the point where anyone who needs to get a test in the country can get it that same day.
So what is standing in the way? Supply shortages, including the testing kits and nasal swabs. Infrastructure shortages, not enough machines and labs to run the tests. And there aren't enough people, from those who administer the tests to those who process them. Right now, there are an untold number of Americans suffering from COVID-like symptoms who simply can't get tested. Sometimes it takes money. Cersei Farrell struggled for days to get a test. In the end, a relative loaned her $225 to go to a private clinic.
As soon as the doctor called and said, hey, I have a patient, she's got all the symptoms, we need to get her tested, I should have been tested.
Widespread testing is just part of the equation. Getting a handle on transmission requires knowing who has it and who they exposed.
But I want to emphasize how much EMS constantly prioritized the folks whose lives are in immediate danger and rushed help to them. To Dr. Barbeau and Dr. Daskalakis, if you could speak to issues like where cardiac arrest may have been in some form or fashion related to the coronavirus, that would be helpful to put this in perspective.
And I want to just build on what you've laid out to really start off by saying that each of these deaths is a tragedy, and we all feel it as New Yorkers. And what we have been putting in place as a part of this response is really to maximize the number of people that we save. And the unfortunate reality is that there have been people who have died either directly because of COVID or indirectly because of COVID. And we've talked a little bit about that in the past, but I think seeing it in black and white, so to speak, with regards to what the numbers show, gives us really a moment of pause and reflection on what we as a city are going through. And, I just want to start off by saying that in the health department, we have started a moment of silence to really acknowledge the New Yorkers that have died because of COVID. And
what lying for?
All right, guys. Here I went on Google and I checked how many deaths due to COVID-19. And now here on the graph is showing us that we've just hit over 10,000 deaths. And this is as of April 14th, which is yesterday. But this site is updated every 50 minutes, as we can see here. So what I want to say is, in my opinion, these deaths are all, well, the death rate is heightened in what it claims to be, based on what they're saying, not what I'm saying. According to them, even those who were assumed to have COVID-19 and died were labeled as COVID-19 deaths. Assumed. Now, we were told back then we didn't have enough test kits, so the testing was basically off presumption. And we were also told that COVID-19, the symptoms were flu-like. So if you had the flu, you were labeled as COVID-19. Where did the flu go? All on assumed testing. Now in March, the CDC dropped a newsletter basically letting the doctors know, and those who sign death certificates, that even if it is assumed COVID-19, it will be on the death certificate as related to COVID-19. So let's say if somebody was dying, they got pneumonia, and that's a symptom of COVID-19, you were labeled as COVID-19 death. Now, we don't see the scare in that, and that's how they're putting us down more and keeping us in lockdown. We don't see that in 1 month. We've basically lost everything in 1 month. They're telling us when to go outside, where to go. They're sending us checks, and we can't even spend it anywhere, where everything's closed. So what are we doing? We're getting more fiat money, but that's not going anywhere. Do we not see the Hegelian dialectic going on? It's all here. It's in your face. Orwellian society is coming soon, if we let it happen. What happened to we the people? Bill of Rights, the Constitution. Didn't we fight not to have big government, and we just let it happen? Now we got this article from CNN. U.S. on track for one of the worst flu seasons in decades. This was January 6, 2020. CNN. This flu season is shaping up to be one of the worst in decades, according to the United States top infectious disease doctor. And look who it is. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said while it's impossible to predict how the flu will play out, bing bing, coronavirus, COVID-19, Impossible. We don't know. Came out of nowhere. The season so far is on track to be as severe as the 2017-2018 flu season, which was the deadliest in more than 4 decades, according to the U.S. Centers for Disease Control and Prevention. The initial indicators indicate this is not going to be a good season. This is going to be a bad season, Fauci said. And what's going on right now? People in havoc for coronavirus. Or is it the flu again? Let's keep reading. So far this flu season, at least 2,900 people in the U.S. are estimated to have died of the flu. This is January 6th, people. Flu season starts what? October, November. There was no shutdown then. Nobody was masking up. Nobody was taking precaution. Nobody was 6 feet away from the next person. Keep reading. Flu cases and hospitalizations because of the flu have also risen sharply since the season began in October. CDC estimates there have been at least 6.4 million flu illnesses and 55,000 hospitalizations. COVID-19. Fauci said it's possible this steep rise in the flu activity could reverse itself soon, in which case the season wouldn't end up being so severe. So they switch it to COVID-19, and now we just dropped the flu. So the flu just went out of nowhere. Heard you. Fauci pointed out a CDC graph to compare the current flu season to two of the most severe in recent decades. In the graph below, designed by the CNN based on the CDC data, the red line indicates flu activity from September 29 through December 28. The other lines show the 2014 to 2015 and 2017-2018 flu seasons, two of the worst in recent decades. So far this season, flu activity has surpassed the peak for 2014-2015 and is climbing toward the peak for the particularly deadly 2017-2018 season. We don't want it to keep going up and up like 2017-2018, he said. Hopefully it won't, but if it continues to go straight up, this could be a really bad year. Now, I'm not going to keep going up, but as we can see where this goes. People, please, they're just fooling you. Now we got an article here from the New York Times. NYC death toll soars past 10,000 in revised virus count. The city has added more than 3,700 additional people who were presumed to have died of the coronavirus but had never tested positive. Wow. And that doesn't open an eye for anybody. New York City, already a world epicenter of the coronavirus outbreak, sharply increased its death toll by more than 3,700 victims on Tuesday, after officials said they were now including people who had never tested positive for the virus but were presumed to have died of it. People, these are why the figures are going up. They're telling you in your face that they're just adding people to the list that never tested positive to add more deaths to the numbers to scare you. And now Mayor de Blasio is ordering 50,000 homemade test kits when China got the virus first, and weren't they testing people first? So wouldn't we have the same test kits as them? And shouldn't have we been preparing when they got the outbreak? But then we had no test kits, but now we can get 50,000 homemade test kits. People, please, just reread the information with an open eye. It's in your face. So we saw some stuff from CNN, CDC, New York Times, de Blasio, Cuomo, where they're going up in numbers and numbers and numbers and deaths. I showed you information where even they're saying presumed deaths are being labeled as actual deaths, which is not what you do in the medical field. You're supposed to write the symptoms, or not even the symptoms, but the cause of death. And if it was pneumonia, it was pneumonia. If it was this, it was this. If it was that, it was this. If it's something that's giving you flu-like symptoms, you just want to name it coronavirus or COVID-19 just to start scaring people. And this is what's happening. Mass hysteria. We got to wear a mask. I don't even have mine on me that my job gave me. I'm somewhere in the backseat. We're told where to go, when to go. Guys, we're headed for the Orwellian society. 5G's coming up, and Big Brother is definitely watching for a long time. Now, they're going to be watching when you fart. Watch. You're going to fart too loud and you're going to get a fine for it. Think it's a joke. What? So I've shown you guys some proofs of my thinking, where I'm going with certain things. It's up to you guys to start thinking outside the box and seeing where we're going with this. Because the numbers are there, right? But it just doesn't match up with what they're saying. Think, people. Just a little bit of this goes a long way. Don't just listen and obey. That's what they want. That's not who we are.
And if you are taught how to observe, you cease to observe.